Okay, then let's start with answering some questions about breast augmentation on real self. The first question is 7 months post-operatively feeling pain and twinges in both my breasts, right is more achy. Can you advise? First of all, is it normal to experience pain even 7 months after surgery? The most typical scenario is immediately after surgery, the pain reaches its maximum, and following the few weeks after the surgery, the pain gradually decreases, and a few months after surgery, the pain almost completely fades away. This is the typical and the most common scenario after the operation. But it's not uncommon to observe some patients reporting prolonged pain or even a more intensive pain a few weeks to months following the surgery. What are the most common reasons of this concept? What's the most common reason of this prolonged pain on the chest? The first one is, as you know, particularly if we're placing the implant under the muscle, we're creating a pocket by releasing some muscle fibers and cauterizing and cutting those muscle fibers. And when those muscle fibers try to heal, they usually trigger an inflammatory response, and this inflammation by itself will decrease the pain threshold of your muscle, of your chest muscle, which is the pectoralis major muscle. And this will cause a discomfort and pain in the area. The second one is we're not only cutting the muscle itself, but also some microscopic nerve fibers are being cut as well. And as those nerve fibers try to heal, the early premature nerve fibers are so sensitive that even with the slightest touch or stretch sensation, those nerve fibers may trigger a pain response. So this was the second reason. The third one is when we place an implant under your muscle or under your skin as well, we're actually changing the functional anatomy of this area. Particularly if it is under the muscle, we're changing the functional anatomy that now the muscles try to remodel themselves and try to adapt to the new configuration or the new relation between them. Therefore, that new state will trigger a functional, mechanical kind of a muscle pain. And this main pain may be prolonged, and it may even be extended up to a couple of months following the surgery. And the last most common reason is, as you know, when we place an implant, your body tries to restrict it by creating a capsule. And sometimes this capsule, if it is firm or if it's an early stage of a problem, which is called as a capsule contracture, this will be associated with pain as well. So a capsule contracture could be associated with pain in the chest and the breast area as well. So these are the most common reasons of prolonged pain or even, let's say, worsening pain a few weeks to months after the surgery.